Good evening, friends. Here is a highly professional, engaging, and well-structured YouTube video. It covers the absolute latest, breaking cardiology developments as of July 12, 2026, balancing massive clinical trial updates with cutting-edge medical technology and public health announcements. Breaking cardiology news, July 12, 2026. Perfect for medical professionals, tech enthusiasts, and health-conscious viewers. Intro. Welcome back, everyone. Today is July 12, 2026, and the world of cardiology is moving faster than ever. If you think heart care is still just about prescribing statins and telling people to exercise, prepare to have your mind blown. Today, we are unpacking a series of massive breakthroughs that are fundamentally shifting how we treat everything from heart attacks and heart failure to high cholesterol. We've got the fresh-off-the-press Phase 3 results from the Cardiology Transform trial, a major change in standard guidelines for acute pulmonary embolisms, a radical push for universal screening by age 17, and a jaw-dropping look at CRISPR gene editing that could permanently erase high cholesterol. Whether you're a practitioner keeping up with standard of care or just someone wanting to protect your own heart, you cannot afford to miss this. Let's dive in. Segment 1, the Cardiology Transform Shockwave. Transthyretin-mediated amyloid cardiomyopathy, ATTRCM, misfolded proteins blocking the heart muscle. First up, we have to talk about the massive breaking news from AstraZeneca and Ionis regarding their highly anticipated drug, Wainua, eplontersen. The Cardiology Transform Phase 3 trial just wrapped up its analysis, and the results have sent shockwaves through the cardiovascular community. This was the largest trial of its kind, tracking over 1,400 patients across 20 countries suffering from ATTR cardiomyopathy, a progressive, fatal condition where misfolded TTR proteins build up in the heart. Here is the twist: the trial did not meet its primary efficacy endpoint. When added to the current standard of care, which already includes stabilizers like tafamidis, Wainua did not show a statistically significant benefit in reducing cardiovascular mortality or recurrent cardiovascular events. The silver lining: in a pre-specified subgroup analysis of patients who took Wainua as a monotherapy, without the stabilizer, fewer primary composite events were observed, showing nominal significance. What does this mean for the future? It means that combining these targeted therapies doesn't automatically equal better results. Cardiologists are going to have to look much closer at tailored, patient-specific combinations rather than a blanket dual therapy approach. Segment 2, redefining pulmonary embolism care and the beta blocker debate. Next, let's look at the newly rolled out 2026 AHA/ACC guidelines for acute pulmonary embolism. The medical community has officially transitioned to a highly nuanced risk classification system. We've gone from simple definitions to clinical categories stretching from Category A, which tracks subclinical, incidental, and asymptomatic P, all the way to Category E, which defines high-risk patients in cardiogenic shock or cardiac arrest. The inclusion of new intermediate modifiers for normotensive shock means ER doctors and cardiologists can now catch impending cardiopulmonary failure hours before it manifests as flat-out hypotension. Speaking of shifting guidelines, let's talk about beta blockers. For decades, the knee-jerk reaction for any patient surviving an acute myocardial infarction was long-term beta blocker therapy. But the recent data from the REBOOT trial has triggered a massive re-evaluation. The REBOOT trial evaluated beta blockers in heart failure patients with preserved ejection fraction and those with an EF over 40% post-infarction. The verdict? No clinical or mortality benefit. Because of this, several European health systems are already moving to stop reimbursing beta blockers beyond 2 years for patients who have undergone successful revascularization with good left ventricular function. The era of taking pills just because is coming to an end. Segment 3, the door to unload, STEMI DTU, paradigm shift. Now, if you want to understand how interventional cardiology is changing right now in the cath lab, you need to look at the STEMI DTU trial. When a patient comes in experiencing a massive heart attack, a STEMI, the gold standard has always been simple: open the artery as fast as humanly possible. Door to balloon time is everything. However, a fascinating hypothesis emerged. What if we mechanically unloaded the left ventricle using a heart pump like the Impella before opening the artery? The goal was to reduce the overall infarct size and prevent the heart failure that plagues 75% of anterior STEMI survivors over the next 5 years. The STEMI DTU study data delivered a major reality check. Mechanically unloading the heart prior to PCI did not significantly reduce heart muscle damage compared to standard, immediate reperfusion. For high-risk PCIs, mechanical support isn't a magic bullet. In fact, registry data suggests that unnecessary deployment might even add complications. Speed is still king. Open the vessel, save the muscle. Segment 4, Public Health Shock, Screen at age 17? Cholesterol test at 17, lifestyle B-roll, fast food, vaping, sedentary remote work. Shifting focus to preventive cardiology, we have an urgent wake-up call that is trending across global health networks. Dr. Devi Shetty, chairman of Narayana Health, referencing the latest Cardiology Society of India guidelines, has made a radical recommendation: every individual should get their first formal cholesterol lipid panel at age 17. Why so young? Because cardiovascular disease is catching the younger generation at an alarming rate. Doctors are pointing to a perfect storm: high-sodium fast foods, sugary beverages, extreme sleep deprivation from irregular screen time, and rising urban air pollution. The guidelines also stress that men between 35 and 40 should undergo routine CT scans of the heart, and anyone with a family history of heart disease shouldn't wait. They need comprehensive cardiac evaluations by age 30. Catching high lipids or early arterial plaque in your late teens or 20s allows for lifestyle and medical interventions that can add decades to your life. Segment 5, CRISPR and AI, the sci-fi future of cardiology. Finally, let's look at the absolute cutting edge of tech: CRISPR gene editing and artificial intelligence. Imagine a world where you don't take a pill every day for high cholesterol. Instead, you get a single, one-time intravenous infusion. We are tracking data where a single CRISPR infusion reduced LDL cholesterol by roughly 50% and triglycerides by 55% at the highest dose, with zero serious adverse events reported. Dr. Stephen Neeson of the Cleveland Clinic noted that this represents a staggering clinical advance. Phase 2 trials running throughout 2026 are currently evaluating the long-term durability of this treatment, paving the way for a literal cure for inherited high cholesterol. And we can't talk about 2026 without mentioning AI. AI-enabled ECG interpretation is no longer a gimmick. Machine learning algorithms are now instantly detecting subtle left ventricular dysfunctions and recognizing complex arrhythmias from simple surface ECGs and wearables. Even better, AI is completely streamlining clinical trials by automating event adjudication across electronic health records, allowing life-saving therapies to get to patients in months rather than decades. Missile medical news. The impact of congenital measles. Congenital measles occurs when measles virus is transmitted from the mother to her neonate, typically when maternal measles infection is within 10 days of delivery. For 5, unlike rubella, measles during pregnancy is not associated with congenital defects. 6, 7, rather, congenital measles presents in the first 10 days of life with fever, maculopapular rash, and potentially severe complications including encephalitis, pneumonitis, hepatitis, and death. 2, 3, neonates are also at increased risk of developing early subacute sclerosing panencephalitis (SSP), a rare 7 to 11 per 100,000 measles cases, but fatal degenerative disease affecting the central nervous system. 7-9, SSP is characterized by intellectual and behavioral deterioration and seizures that develop 7 to 10 years following measles infection. 8, mortality is 100% within 1 to 3 years of onset. 9. Medscape. Chest pain. It can be a sign of heart, lung, or stomach problems, so see your doctor to rule out those causes. Sometimes, though, it's a symptom of depression. Depression can also raise your risk of heart disease. Plus, people who've had heart attacks are more likely to be depressed. WebMD. The heart is one of the organs least likely to develop cancer, a long-standing biologic puzzle that may now have an explanation. A study published in Science found that the mechanical load generated by the beating heart suppresses tumor cell proliferation through a molecular pathway that alters gene expression, raising the possibility of new therapeutic targets. Mechanical protection. Tumors that originate directly in the myocardium are exceptionally rare, occurring in less than 1% of autopsies. Even cardiac metastases, which have been reported in up to 18% of autopsies, are often small, asymptomatic, and incidentally discovered. Although this phenomenon has long been recognized, its biologic basis remains unclear. Medscape. Outro and CTA. The landscape of cardiology is being rewritten right before our eyes. From the sobering results of the Cardiology Transform and STEMI-DTU trials to the incredible promise of CRISPR and AI diagnostics, the way we protect our hearts is smarter, faster, and more precise than ever. What do you think? Would you undergo a CRISPR infusion to permanently drop your cholesterol? Let me know in the comments below. Don't forget to hit that like button, subscribe for your daily dose of medical breakthroughs, and share this video with someone who cares about their heart health. Stay healthy, and I'll see you in the next video. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm. Postscript. Red Circle. Today's breaking cardiology news, July 12, 2026. We break down the absolute latest clinical trials, changing guidelines, and medical tech transforming heart health today. Timestamps. Midnight introduction 1:30, Cardiology transform phase 3 failure and silver lining. 5 o'clock, a new acute pulmonary embolism guidelines and the beta blocker debate. 8:30, STEMI DTU trial results, does mechanical unloading work? 12 o'clock, a public